Harm reduction policing, or HRP, is a new way for police to approach drug use. It shifts the focus from punishment to reducing the harms caused by drugs. This approach recognizes that people use drugs for various reasons, and simply arresting them doesn't solve the problem. Instead, HRP prioritizes connecting individuals with support services like healthcare and treatment. Traditional drug policies often criminalize drug use. This leads to arrest, imprisonment, and a criminal record. These consequences can make it harder for people to get jobs, housing, and education. HRP understands that these approaches are often ineffective and can actually increase harm. Instead of punishment, HRP emphasizes compassion and support. It aims to meet people where they are in their lives. The goal is to reduce the negative consequences of drug use, such as overdose, disease transmission, and social isolation. This approach benefits individuals and creates safer, healthier communities. Traditional drug policies rely heavily on punishment. People caught with drugs often face arrest, prosecution, and incarceration. This approach, however, fails to address the root causes of drug use, such as poverty, trauma, and mental health issues. Moreover, criminalizing drug use creates a stigma. This stigma prevents individuals from seeking help when they need it. They fear judgment and punishment. This fear can have tragic consequences, leading to overdoses and the spread of infectious diseases. The criminal justice system, while necessary for serious crimes, is ill-equipped to deal with the complexities of drug use. Prisons often lack adequate resources for drug treatment and rehabilitation. This means that people leave prison without the support they need to stay away from drugs. In essence, traditional drug policies have created a revolving door of arrest, incarceration, and relapse. They have failed to reduce drug use and have caused significant harm to individuals and communities. Harm reduction offers a different path. It acknowledges that abstinence isn't always immediate or possible for everyone. Instead of demanding immediate cessation, it focuses on minimizing the negative consequences associated with drug use. This approach prioritizes meeting people where they are and providing them with the support they need to make positive changes in their lives. One key principle of HRP is pragmatism. It recognizes that people use drugs for various reasons and that demanding complete abstinence isn't always realistic or effective. Instead, HRP focuses on reducing the harms associated with drug use, such as overdose, HIV/AIDS transmission, and public disorder. Another crucial aspect of HRP is compassion. It views people who use drugs not as criminals, but as individuals who deserve support and respect. This approach helps to break down stigma and encourage people to seek help without fear of punishment. Collaboration is another essential element of HRP. It involves partnerships between law enforcement, public health agencies, community organizations, and people who use drugs themselves. By working together, these stakeholders can develop more effective and humane strategies to address drug use and its associated harms. Success in action: real-world examples of HRP. Around the world, there are many successful examples of harm reduction policing in action. These programs demonstrate that a compassionate and pragmatic approach can lead to positive outcomes for individuals and communities. Programs like Law Enforcement Assisted Diversion, LEAD, have been successfully implemented in cities such as Seattle, San Francisco, Baltimore. LEAD redirects individuals involved in drug use, sex work to essential social services, including mental health facilities, homeless shelters, and sobering centers. 12 months after the implementation of LEAD in San Francisco, participants showed significantly lower rates of both misdemeanor and felony arrests, as well as a reduction in felony cases. Between 2015 and 2020, law enforcement in New York responded to suspected overdoses before emergency medical services in 85.9% of cases, highlighting their critical role as first responders. Over 80% of law enforcement agencies across the United States now equip officers with naloxone, demonstrating a widespread commitment to life-saving overdose interventions. HRP addresses social determinants like housing instability and mental illness through coordinated efforts, offering holistic interventions that tackle both individual and structural drivers of urban substance use. A Canadian study found that police presence near supervised injection sites discouraged use, while collaboration between police and health services improved safety for PWDs. In Copenhagen, Denmark, HRP strategies include engaging street-based people who use drugs, especially those avoiding or restricted from drug consumption rooms. Police encourage safer practices to minimize overdose risks and reduce public disturbances. These examples demonstrate that harm reduction policing can lead to significant improvements in public health and safety. A safer future. Embracing harm. Reduction in policing. Harm reduction policing represents a significant shift in how we address drug use and its associated challenges. It moves away from outdated and ineffective punitive approaches and instead embraces compassion, pragmatism, and collaboration. While challenges and criticisms remain, the evidence clearly demonstrates that harm reduction policing can save lives, reduce harm, and create safer communities. As we move forward, it is essential to continue advocating for and expanding harm reduction policing strategies. This includes increasing funding for harm reduction programs, educating law enforcement and the public about the benefits of harm reduction policing, and challenging the stigma associated with drug use. By embracing harm reduction, we can create a future where drug policies are grounded in evidence, compassion, and a commitment to the well-being of all members of society.